Before we start today's deep dive, please remember to subscribe, like, and share this video, as it really does help us to reach a wider audience. But without further ado, let's get into today's deep dive. Growing old is something most of us hope to do. We spend our lives planning for it. We save money, build careers, raise families, buy homes, make pensions, and we do all of that believing that when the time finally comes, there will be a system ready to support us if we ever need it. But what happens when that system begins to struggle? Over the past few months, Britain's social care system has once again returned to the centre of national debate. Governments have promised reform. Health leaders have warned that the current system is under enormous pressure. Local authorities continue to face rising costs. Care providers say they are struggling to recruit and retain staff. Families describe exhausting waits for support. Hospitals report increasing numbers of patients who are medically fit to leave but cannot be discharged because appropriate care simply isn't available. Perhaps the most sobering statistic of all is this. Recent reporting suggests that more than 30,000 people in England died while waiting for social care during 2024 to 2025. Behind every one of those numbers was a person, a family, a story, and a question. How did one of the world's wealthiest countries arrive at this point? Because this isn't a problem that appeared overnight. It didn't begin this year. It didn't begin with one government or one political party. The pressures we see today have been building for decades. An aging population, people living longer than ever before, medical advances allowing conditions that were once fatal to become manageable, a shortage of care workers, growing financial pressure on local councils, and repeated promises that meaningful reform was just around the corner. Many people agree that the system needs to change, but there is far less agreement about what that change should actually look like. Some argue that Britain should create a national care service. Others believe existing services simply need better funding. Some call for a completely different way of paying for care. Others argue the entire relationship between the NHS and social care needs to be redesigned. Yet before we can even begin discussing possible solutions, we first need to answer a much more basic question. What exactly is social care? Because despite hearing the phrase regularly in the news, many people still confuse it with the National Health Service. And although the two work closely together, they are not the same thing. The NHS exists primarily to treat illness and injury. If you break a bone, need an operation, develop an infection, or require emergency treatment, the NHS is there to provide healthcare. Social care is different. It focuses on helping people live their everyday lives when age, illness, disability, or frailty make ordinary tasks difficult. That support may involve helping somebody get dressed in the morning, preparing meals, taking medication, washing, shopping, moving safely around their home, or providing full-time residential care when independent living is no longer possible. In other words, healthcare helps people recover whenever possible. Social care helps people continue living with dignity when recovery is no longer the main challenge. The distinction may sound simple, but it sits at the very heart of Britain's current crisis, because while NHS treatment is generally provided free at the point of use, social care operates under a very different system. Many forms of support are means-tested. Some people receive financial assistance, others contribute towards the cost. Some families find themselves paying significant amounts for long-term care, particularly if residential care becomes necessary. That difference often comes as a surprise. Many people assume the NHS and social care form one seamless public service. In reality, they have developed separately for decades. And those separate systems have sometimes created enormous pressure where they meet. One of the clearest examples can be seen inside Britain's hospitals. Every day, doctors declare patients medically fit to leave. Their treatment has finished. Their hospital bed is no longer the best place for them, but they cannot safely return home because the support they need simply isn't available yet. Perhaps a care package has not been arranged. Perhaps there aren't enough carers. Perhaps a suitable care home place cannot be found. So the patient remains in hospital, not because they still need hospital treatment, but because there is nowhere else for them to go. That creates another problem. The hospital bed remains occupied. Another patient waits longer in accident and emergency. Operations are delayed. Ambulances queue outside. A shortage of social care gradually becomes a shortage of healthcare. Two separate systems become one shared crisis, and that's why so many health experts now argue that it no longer makes sense to talk about the NHS without also talking about social care, because one cannot function properly without the other. To understand how we reached this point, we need to go back almost 80 years. When the Second World War ended, Britain faced an enormous challenge. Millions of people had endured years of conflict. Healthcare was inconsistent. Access often depended upon where you lived or how much you could afford to pay. The country wanted something different. In 1948, the National Health Service was created on a simple but revolutionary principle. Healthcare should be available to everyone, free at the point of use, funded through taxation. It became one of the defining achievements of modern Britain. But while the NHS transformed healthcare, social care evolved very differently. Instead of becoming one nationally organised service, responsibility gradually fell to local authorities. Over time, councils became responsible for assessing needs, arranging support, and helping fund care for those who met specific eligibility criteria. That system functioned reasonably well, while Britain remained a relatively young country. Life expectancy was lower. Fewer people lived into their late 80s and 90s. Many of the medical conditions we now manage successfully simply weren't survived decades ago. But success created an unexpected challenge. People began living longer, far longer. Medical science advanced at an extraordinary pace. Heart disease became more treatable. Cancer survival improved. Joint replacements restored mobility. Medicines controlled conditions that would once have been fatal. These are achievements worth celebrating. They represent one of humanity's greatest successes. But they also created something few policymakers had fully anticipated. More people were living long enough to require ongoing support rather than short-term treatment. Conditions such as dementia became increasingly common. Frailty became a larger part of healthcare planning. People weren't necessarily becoming less healthy. They were living long enough to experience conditions associated with advanced age. And that changed everything. The challenge was no longer simply helping people survive. It was helping them live well for much longer. That required more carers, more community support, more specialist accommodation, more funding, and perhaps most importantly, more long-term planning. Unfortunately, planning rarely keeps pace with demographics. For many years, reports warned that Britain's population was ageing. Successive governments commissioned reviews. Expert panels produced recommendations. Think tanks published forecasts. Professional organisations raised concerns. Almost everyone agreed the pressures would continue increasing. Yet meaningful reform repeatedly proved difficult. Partly because social care is expensive, partly because no government wanted to tell voters that solving the problem might involve paying more tax, introducing new funding systems, or asking individuals to contribute differently towards their own care. Proposed solution created winners and losers. Every reform generated political controversy. As a result, many changes were announced. Some were delayed, others were abandoned. Several were replaced before they were fully implemented. Meanwhile, demand continued rising. Today, local councils spend a significant proportion of their budgets on adult social care. Many argue those budgets still fail to match growing demand. Care providers say increasing costs make it difficult to recruit and retain enough staff. Families often find themselves filling gaps that formal services simply cannot cover. Perhaps nowhere is this more visible than among unpaid carers. Across Britain, millions of people now care for parents, partners, children, brothers, sisters, friends, often while trying to maintain full-time employment themselves. Some reduce their working hours, others leave employment altogether. Many experience exhaustion, financial pressure, and declining health of their own. They rarely appear in political speeches, yet without them, the current system would struggle even more than it already does. In many ways, Britain's social care system relies not only upon professional carers, but also upon the quiet dedication of families who never expected to become carers themselves. And that raises another important question. If unpaid carers are already carrying so much responsibility, what happens as Britain's population continues getting older? Demographers have been asking that question for years. The answer is not straightforward. People are living longer. Birth rates have fallen. The proportion of older people within the population continues increasing. That means fewer working-age people are supporting a growing number of retired citizens. The challenge extends beyond social care. It affects pensions, healthcare, housing, public finances, employment, taxation, almost every part of society. Countries across Europe, Japan, South Korea, Canada, Australia, and many others are facing remarkably similar pressures. Britain is not alone, but each country has responded differently. Germany operates a compulsory long-term care insurance system funded through payroll contributions. Japan introduced national long-term care insurance in response to one of the world's oldest populations. The Netherlands combines compulsory insurance with strong community support. Scandinavian countries generally provide more extensive, publicly funded care, supported by comparatively higher taxation. None of these systems is perfect. All face rising costs, all continue adapting. But comparing them reminds us of something important. There is no single model that every country agrees is best. Every nation balances affordability, fairness, personal responsibility, and public funding differently. Which means Britain's challenge isn't finding a perfect solution. It's deciding which trade-offs society is willing to accept. Perhaps the most frustrating part of Britain's social care crisis is that very few people can honestly say they didn't see it coming. For decades, successive governments have acknowledged that reform was needed. Independent reviews have warned that the system was becoming increasingly difficult to sustain. Charities have highlighted growing waiting lists. Care providers have warned about staffing shortages. Local authorities have repeatedly argued that rising demand has outpaced available funding. And families have continued telling remarkably similar stories year after year. Yet, despite widespread agreement that change is necessary, meaningful reform has remained remarkably elusive. Part of the difficulty lies in the way social care is funded. Unlike the NHS, which is largely financed through general taxation, adult social care involves a complex mixture of public funding, local authority budgets, means testing, and private contributions. That complexity often leaves people uncertain about what support they are actually entitled to receive. Many families only begin learning how the system works at the very moment they need it. Often during one of the most stressful periods of their lives, a loved one becomes ill, a parent develops dementia, a relative suffers a fall, hospital treatment finishes. Then a completely different set of questions begins. Who pays? Who organises care? How long will it take? What happens if suitable care isn't available? Can somebody remain safely at home? Or will they eventually need residential care? These are deeply personal questions. Yet for many families, they quickly become financial questions as well. Because unlike healthcare, long-term social care can involve substantial personal costs depending upon an individual's circumstances. Some people qualify for significant local authority support. Others contribute towards their care. Some fund it almost entirely themselves. The result is a system that many people describe as confusing, unpredictable, and difficult to navigate. That uncertainty doesn't only affect older people, it affects sons, daughters, partners, grandchildren, neighbours. Entire families often find themselves making life-changing decisions with very little previous knowledge of how the system actually operates. And while families are trying to understand those decisions, care providers are facing pressures of their own. Recruiting staff has become increasingly difficult. Caring is one of the most important jobs in society. It requires patience, compassion, professional judgment, physical stamina, emotional resilience. Yet despite those responsibilities, many care workers continue to report feeling undervalued. Providers compete for staff in a labour market where supermarkets, warehouses, and other employers may offer similar or even higher wages with considerably less emotional pressure. The work itself can also be physically and emotionally demanding. Supporting people through illness, frailty, dementia, or the final stages of life requires enormous commitment. Burnout has become a growing concern across the sector, and every experienced carer who leaves creates additional pressure on those who remain. This shortage doesn't simply affect care homes, it affects home care services, community support, hospital discharge teams, general practice, and ultimately, the NHS itself. Because when social care struggles, healthcare struggles too. Imagine an older patient who has successfully recovered from surgery. The doctors are satisfied, the nurses are satisfied, medically. There is no reason for them to remain in hospital, but they live alone. They need help washing, preparing meals, taking medication safely. Perhaps someone needs to visit several times each day. Until those arrangements are in place, leaving hospital simply isn't safe. So they stay. Not because they still require medical treatment, but because the support waiting for them outside the hospital doesn't yet exist. Multiply that by thousands of patients across the country, and the consequences become obvious. Hospital beds remain occupied. Emergency departments become busier. Ambulances wait longer to hand over patients. Operations are postponed. Waiting lists grow. A shortage of carers in the community quietly becomes pressure across the entire healthcare system. This is one of the reasons so many health experts argue that discussions about the NHS and social care can no longer happen separately. They're two different systems, but in practice, each depends upon the other functioning effectively. Perhaps nowhere is that relationship clearer than in Britain's ageing population. Medical science has achieved something remarkable. People are living longer than previous generations ever imagined possible. Someone reaching their 80s or 90s today may have survived illnesses that would once have been untreatable. That is something to celebrate. But longevity also changes the nature of care. The challenge is no longer simply helping people live longer. It's helping them live those additional years with dignity, safety, independence, and the support they need when independence becomes more difficult. That requires planning, measured not in months, but in decades. And that brings us to one of the most important questions facing not just Britain, but many developed countries around the world. If populations continue aging and demand for care continues increasing, how do we build a system capable of supporting future generations without placing an unsustainable burden on those who come after them? Because ultimately, this conversation isn't really about today's crisis alone. It's about whether the systems built for the 20th century are capable of meeting the realities of the 21st. And that question may ultimately be the most important one of all. Because the pressures facing social care are not expected to disappear. In fact, almost every long-term projection suggests they will increase. Medical science will continue advancing. People will continue living longer. The number of older adults requiring support is expected to grow steadily over the coming decades. That is, in many ways, something to celebrate. Longer lives are one of humanity's greatest achievements, but they also require societies to think differently. Healthcare was largely designed to treat illness. Social care exists to support daily life. As more people live into their 80s, 90s, and beyond, the balance between those two systems becomes increasingly important. If demand rises faster than the workforce, waiting times may increase. If funding struggles to keep pace, local authorities may face even greater financial pressure. If unpaid carers become overwhelmed, more families may find themselves struggling to balance work, caring responsibilities, and their own well-being. These aren't distant possibilities. Many families already experience them today. Perhaps one of the most overlooked aspects of this debate is the impact on unpaid carers themselves. Millions of people quietly provide care every single day without considering themselves carers at all. They are sons helping elderly parents, daughters organising medication, partners assisting with mobility, neighbours checking that someone has eaten, friends driving people to appointments. Most never expected to become carers. Many simply stepped in because somebody they loved needed help. Yet caring can change almost every part of a person's life. Working hours are reduced, careers are interrupted, retirement plans change, income falls, stress increases, physical and emotional exhaustion become common. In some cases, the person providing care begins needing support themselves. That creates a cycle which many experts believe receives far less attention than it deserves. Because when unpaid carers reach breaking point, the formal care system faces even greater pressure. Looking ahead, technology is often presented as part of the solution. Artificial intelligence, remote monitoring, smart homes, wearable health devices, medication reminders, fall detection systems, robotics. Many of these innovations already exist. Some have enormous potential. A sensor that alerts family members when an elderly relative falls could save lives. Remote monitoring may allow people to remain independent for longer. Artificial intelligence may eventually help identify health problems before they become emergencies. But technology cannot replace human compassion. It cannot sit with someone who feels lonely. It cannot comfort a frightened person living with dementia. It cannot replace the reassurance that comes from another human being simply being present. Technology may reduce pressure, it may improve efficiency, It may help people remain independent for longer, but it is unlikely to remove the need for carers. If anything, it may allow carers to spend more time doing what only people can do: supporting other people. That brings us to another important question. If almost everyone agrees the system needs reform, what might that reform actually look like? There are many ideas. Some argue Britain should create a national care service, bringing social care closer to the NHS with more consistent national standards. Others believe the current structure could work if councils received more stable long-term funding. Some suggest introducing a compulsory social care insurance system similar to those used elsewhere in Europe. Others argue the answer lies in better pay, improved training and clearer career pathways so that caring becomes a profession more people choose to enter and remain within. Each proposal has advantages. Each also comes with costs. Higher public spending requires funding, insurance schemes require contributions, tax increases are rarely politically popular, and simply spending more money does not automatically solve workforce shortages if recruitment and retention remain difficult. There is no single solution that experts universally agree upon. And perhaps that's why reform has proved so difficult for successive governments. The challenge isn't recognising the problem. Almost everyone already agrees there is one. The challenge is deciding how society chooses to pay for the solution. Because every option ultimately asks the same question: who should carry the responsibility? The individual, the family, the taxpayer? Or should that responsibility be shared between all three? There are no easy answers. But there is one reality that becomes increasingly difficult to ignore. Doing nothing is also a choice, and doing nothing carries its own cost. Longer waiting times, greater pressure on hospitals, more exhausted families, increasing financial strain on local authorities, and growing uncertainty for millions of people wondering what support might be available if they, or someone they love, eventually needs care. Perhaps that is why this conversation matters so much. Not because every one of us works in social care, not because every one of us currently needs care, but because, if we are fortunate enough to live long lives, almost every one of us will eventually know someone who does, whether it is a parent, a partner, a friend, a neighbour, or perhaps one day, ourselves. And maybe that is the biggest lesson from today's deep dive. Social care isn't simply another government policy. It isn't just another budget debate. It is a reflection of how a society chooses to care for people during some of the most vulnerable moments of their lives. The true measure of a healthcare system is not only how well it treats illness, it is also how well it supports dignity, independence, and compassion when illness can no longer be cured. Britain's social care system has reached a moment where difficult decisions can no longer be postponed indefinitely. Whatever reforms eventually emerge, they will shape the lives of millions of families for decades to come. The question is no longer whether change is needed. The question is whether that change can happen before the pressures become even greater. And that brings us to the end of today's deep dive. We hope you've enjoyed today's episode, and more importantly, that it has helped explain one of the biggest social challenges facing Britain today. Please remember to like, subscribe, and share this content to help us reach a wider audience. I'm Sophie Jones-Redway. Thank you for joining me, and I'll see you in the next one.